name is Anna. I'm going to be your staff nurse today. Can you please give me your full name and date of birth?
Stephen Bradley Bittner, May 25th, 1968.
Okay, and then how old are you?
51.
Okay, can I check your wristband? Okay, perfect. I'm just going to wash my hands really quick. Now, are you in any pain today?
No.
No, so if I was to ask your pain on a scale of 10 being the worst pain possible and 0 being no pain, you'd be at a 0?
0.
0?
Absolute
Okay.
0. I'm in absolutely no pain.
Okay, perfect. And now, can you please give me your height and weight?
I'm 5'11", 193.5 pounds.
Okay, so I can see the BMI is within normal ranges. Do you have any allergies?
No.
No? Okay, perfect. So we're going to be doing a full head-to-toe assessment today. It should take about 15 minutes. Is that okay with you?
Yes.
Okay, so I'm just going to get started. I'm going to start by looking at your scalp. You could just sit up for me. Perfect. I'm going to part your hair in a couple different places. I'm just looking for any lesions or anything. It all looks good. I can see that the hair is evenly distributed. I can tell that he is well groomed. I noticed your gait when you were walking in here. Your posture is good. You appeared to be able to balance perfectly. You didn't have any limps or anything. So that's all good. And I can see that you're dressed appropriately for the weather, which is wonderful. Okay. Now I see that you wear glasses. Have you had any changes in your vision recently?
No.
No, are you nearsighted or farsighted?
Nearsighted.
Nearsighted? Okay. If you could just take off your glasses for me for a little bit. I'm just going to observe your facial features. Okay, I can see the nose is midline. The eyebrows and eyes are both symmetrical. The mouth is in line with the rest of the face. The ears are in line with the eyes. So everything looks good. Okay, I'm just going to shine this light in your face really quick. Good. Okay, perfect. Now I'm going to have you follow this pen with your eyes. Just with your eyes. Okay, perfect. So I see that perla and those cranial nerves were intact. I'm going to look at your nose. I'm going to have you go like this and breathe in. Good. Now on the other side. Perfect. So the nasal passages are patent. I'm just going to look up them really quick. If you could just look up. Good. Okay. Don't see any abnormal redness. It all looks pink, proper perfusion, which is good. You can look down. Okay, now I'm going to have you smile. You frown. Now puff out your cheeks. Okay, perfect. So everything moves symmetrically. I saw that his teeth were nice and white. I'm going to have you open your mouth. Okay, it all looks pink, which is good. I can see that all of his teeth are intact. And as you lift up your tongue, good. I don't see any lesions or anything. Can you put your tongue down, please? Okay, now say ah.
Ah.
Okay, perfect. I saw the soft palate and the uvula rise perfectly, so he is able to adequately swallow, which is good. Now I'm going to check your ears. See they're in line with the face. Look in them. Don't see any abnormal drainage or wax or anything. No piercings. Okay, they both look good. Okay, I'm going to move on to looking at your upper extremities. If you could just roll up your sleeves for me. Okay, good. Now you can leave it down, don't worry. Okay, so I see that the skin color is consistent with his ethnicity, which is good. I see there's hair in the arm, so they are being adequately perfused. There are a few macules, but nothing that looks at all concerning. I'm going to check the temperature. Good, it feels consistent throughout. Now I'm going to check for skin turgor. Perfect, his skin is nice and elastic, so I can tell that he has adequate perfusion. Okay, I'm going to assess your range of motion now, so I'm going to have you flex your arms like this. Now have you push them out. Good, okay, can you relax for a second? Now I'm gonna have you flex again, but against resistance. So flex your arms in. Good, push your arms out. Okay, perfect. So I can see that his the range of motion in his elbows is nice and strong. I'm gonna have you point your wrists down, point them up, move it in a circle. Okay, good. I'm gonna have you push down again. Good. Just with your wrists, move up. Okay, perfect. So the range of motion in his wrist is nice and strong. Just gonna palpate the hand really quick. Okay, everything feels good. Can you make a fist for me? Spread everything out. Go like this. Okay, spread your fingers out again. Perfect. The range of motion in his fingers is nice and good too. Now I'm just going to assess the capillary refill on each finger, making sure it's less than 3. Okay, good. Everything looks good. Okay, I'm going to move on to your respirations now. So I'm going to listen in 14 different places. I'm going to start in your front. I'm going to do the bronchioles, the bronchovesicular, and the vesicular. And I'm going to listen to 2 spots on your side, and then I'm going to do the same thing on your back, okay?
Okay.
I just want you to breathe normally while I do this.
Okay.
Perfect. I'm going to have you lift up this arm. Good. Lift up the other arm. Okay, now I'm going to have you sit forward a little bit. Good. I'm going to do the same thing on your back. Okay, perfect. So everything sounded okay. I didn't hear any crackles or wheezing or anything. I can tell that his breathing doesn't look forced. He doesn't appear to be in any distress or anything. Okay, now I'm going to jump back up to your head and I'm going to do range of motion. I'm going to have you look up, look down, look to the side, look to the other side. Okay, and I'm going to have you do it again, but against resistance. So look up, look down. wait, look to the side. Okay, look to the other side. Okay, perfect. So good range of motion in the neck too. And the breath sounds all sounded good. So we're all good there. Okay, now I'm going to listen to your heart rate. I'm going to do ape to man, so I'm going to start with the aortic, which is at the second intercostal space on the left. Or, I think. Then we're going to go to the second intercostal space on the right. And that's going to be your pulmonic. Then we're going to go down to the third intercostal space, which is Erb's point. Then we're going to go down to the fourth, which is the tricuspid. Then the fifth, which is the mitral. And that's also where I'm going to listen to your apical pulse for a full minute. Here's where I would palpate for a full minute, but we're not going to actually do that today for the sake of time. Okay, so everything sounded good. You had normal rate and rhythm, which is perfect. Now I'm just gonna listen one more time. I'm gonna use the bell to see if there are any murmurs, okay? Okay, good. I didn't hear any murmurs or anything, so that's perfect. Okay, now I'm just gonna palpate your carotid pulse. Okay, good. So it's 2 plus bilaterally, normal rate and rhythm. I'm gonna do your radial. Good. Once again, normal 2 plus bilaterally, normal rhythm. Okay, now we're gonna go ahead and do your GI. So I'm gonna have you lay flat. Okay, can you lift your shirt for me? Okay. Now, when was the last time you had a bowel movement?
9:37 a.m.
Okay.
Today.
When was the last time you urinated?
6:35 p.m.
Okay, and do you feel like you have to use the bathroom right now?
No,
Okay, and when was the last time you ate?
6:34 p.m.
Okay, so I'm just gonna go ahead and listen to your bowel movements. Just by looking at the abdomen, I can see that it looks flat. I don't see any abnormal masses. The color looks consistent with the rest of the body, which is good. And there's no distension or anything. Okay, good. I was able to hear bowel sounds in all 4 quadrants. They were a little bit hypoactive, but that makes sense because the patient hasn't eaten for a few hours. I'm going to go ahead and palpate. Okay, I'm just feeling for any sort of mass or anything. I'm watching the patient's face to see if he's grimacing. Everything looks fine. Don't feel any abnormal masses. I'm going to check for rebound tenderness. Okay, perfect. Okay, I'm going to have you sit up. Now we're going to go ahead and do your lower extremities. I'm going to have you roll up your pant legs just a little bit. Just to about your knees. Good. Thank you.
Closer.
Okay.
Closer.
What? Okay, so I can see that the skin is consistent with the rest of the body, which is good. I see leg hair, which indicates adequate perfusion. I'm going to check for temperature. Good, it feels symmetrical. It's a little cooler at the feet, but that's perfectly normal. I'm going to check your range of motion, so I'm just going to have you move your knees, kind of kick your legs out like that. Can you go all the way? Okay, good. Now back in. If you could just, can you sit to the edge of the couch? Sorry, bad directions. And kick all the way out. Back in. Good. Okay, I'm going to have you do it again against resistance, so kick out. Okay, pull back. Okay, perfect. So the range of motion in the knees is adequate. You can sit back in a comfortable position. Okay, I'm going to assess the range of motion on your ankles, so I'm going to have you point your toes up. Both feet, good. Point your toes down. Move your ankle in a circle. Good, okay. Now, stop for a second. Okay, point your toes up. Point your toes down. Good, okay, and can you wiggle your toes? Good, I'm just going to feel for your pedial pulse really quick. Okay, so it was 2 plus bilaterally, normal rate and rhythm. I'm going to do capillary refill on your toes. Looks good. And you were able to feel when I pinched down like that?
Yes.
Okay. Okay, I think you can put your pant legs down one thing. I don't remember if I did this. Can you make a fist for me? Okay, good. I think that we're about done. Is there anything else you need from me?
No.
No? Okay, so I'm going to put the bed in the lowest possible position. I'm going to raise 2 of the side rails. I'm going to give you your call light. Okay, I'm going to wash my hands. I should be back in about 30 minutes to check on you, but if you need anything, just hit the call light, okay?
Got it.
Stop recording.